Hi, in this video, I'll be sharing some tips for scheduling your appointments for your breast cancer treatment. Before I go on, I want to encourage you to subscribe to our channel. We're always putting out new content of interest. So I'm going to tell you my point of view as a clinician, somebody who treats people with breast cancer, and then some tips I've learned from my patients and their families and loved ones. So when you are diagnosed with breast cancer, you have a lot of different types of doctors, right? You have a surgeon, a medical oncologist, a radiation oncologist. You might have a plastic surgeon, social worker, nutritionist. You may be seeing a physical therapist, etc. And then there are all the treatments to schedule. So your life is really disrupted. And what I wanted to share are just some tips that I've learned from my patients and things that I know about how scheduling is done that can be useful. First of all, it's much easier to reschedule an appointment that you already have than it is to get in for an appointment. So let's say you see a surgeon and they want to make an appointment for you to see a medical oncologist, but you don't have your calendar with you or somebody who wants to come with you, you don't have their schedule. I recommend that you make that appointment and then you can always call and reschedule it rather than call up fresh and say, I need to get in. So while you're physically on site, make as many appointments as you can, knowing rescheduling is much less complicated. The other thing to consider is picking a day and a time that will work for you regularly. This might not work as you first start out. So your first chemotherapy may be at a really inconvenient time, but that's when you were able to get in. But if you plan ahead, you can pick the same day and time most of the time, so that it becomes more of a routine. In terms of chemotherapy scheduling, most people feel better by around 3 days afterwards. So if you're going to be working, you may want to schedule your treatment on a Friday and then go back to work on a Monday or Tuesday. Whereas if you have a young family, you may wish to get your treatment during the week, and then you'll feel better by the weekend when the kids are around. I'm hoping this makes sense. It's also important to know that you can see your doctor one day. We try to see you before every treatment on chemotherapy and before once a week when you're on radiation therapy. You can see the medical team on one day and get your treatment on another day. And that can decrease your total waiting time, because when you come in for chemotherapy, there usually isn't a wait, whereas it's very easy for us physicians to run behind if we're attending to unexpected needs of other patients. And you can have your blood work done on one day and come in for your treatment on another. So that can really be something that may not be offered to you, but you can ask for. And it's very unlikely that a particular practice would not be able to accommodate that request. Now, if you live very far away, you're not going to want to do that. Speaking about people who live very far away, you may have seen a physician who lives a few hours away from you, but feel that coming that distance for all of your treatments is not something you can do. It's very likely that the physician you saw can recommend somebody closer to you. It's really important to balance treatment with your life, and chemotherapy regimens are quite standard. So you are not likely to get a different treatment at one place than you are another. So it's just something to keep in mind, that you have to balance multiple other things in your life, and there's more flexibility than maybe there appears to be at first. When you schedule radiation, now you don't have to see the doctor or nurse practitioner or physician assistant every time. It's usually once a week that you'll see somebody while you're on treatment. Those are called on-treatment visits. Your radiation therapy is Monday through Friday with some exceptions, and radiation is often offered over a longer, greater number of hours. So you can be treated very early in the day or at the end of the day or on your lunch hour. There's a lot of flexibility. It's a very quick treatment compared to chemotherapy. So you go in, you change into a gown, you wait in the waiting room, then you go and you get treated, and then you leave. So it's much easier for the radiation oncologist to work around your schedule. I obviously can't speak for the place where you'll be getting your treatment, but that's my experience. If you are going to be going away, let your medical team know that well ahead of time, because we can change the date we start so that there isn't a long delay between treatments. We have to work backwards sometimes. So if you're going to be gone for a particular week, you want to make sure your treatments aren't going to be scheduled during that week. We try not to delay, though we can if we have to. And of course, if you have side effects and you need a delay, that's different. But avoidable delays, once we start, we try to avoid. Other appointments with your surgeon, plastic surgeon, physical therapist, just plan far enough ahead of time if you can, because then you're more likely to get a time and day that that work for your schedule. I recommend keeping track of your appointments, whether you use paper or a planner. Always make sure you repeat the date and time back to the person who just gave them to you so that you show up on the right day. It still may happen that you show up on a day and they say you don't have an appointment. That's usually a computer glitch, somebody acting too quickly, writing something down on a card too quickly. So I do recommend a lot of confirmation, because if you travel a long way and are told you can't be seen that day, that's very upsetting. And the staff are really upset too, even though they might seem like they're not. They're really upset. That can ruin their whole day and your whole day, and it ruins their day because it ruins your day. So I hope these tips have been helpful as you think about scheduling things. We have a video on how to stay organized during treatment, but these are just some tips for how to work your schedule and your treatment around each other. If it's helpful, click like. That'll help other people just like you find it. Don't forget to subscribe. You can follow us on Instagram and drop a comment or question below. As always, we try to get back to you as soon as possible. Thanks for watching.